So for those of you who just popped in, welcome. And to those of you who have stayed for the big show here, welcome to the March MedTech Innovation Forum. And for those of you who weren't here in the beginning, I'm Tuni Shartner, the Executive Director of District Hall and Venture Cafe at Providence. We are always excited to host this, this monthly event, and this month's MedTech Forum is always in partnership with Ximedica and NEMIC, New England Medical Innovation Center. Since 2014, Ximedica has conducted this forum as an internal monthly information sharing platform to inform its employees about the newest medical related technologies in the public domain with the intent to spur creative ideas and innovative thinking in their work. Through our partnership, we are excited to bring this monthly forum to spur innovative ideas in all of you. District Hall Providence, I'm here today. We reopened in February. We opened in August of 2019 to support startups, innovators, and small businesses by providing them with a free and open workspace and private meeting rooms and event spaces. We provide engaging free programming that supports entrepreneurship and innovation, including our signature Venture Cafe Thursday gathering, which is today. We've pivoted to provide our community with virtual programming throughout the week, including this program in partnership with Ximedica and NEMIC, and welcome you to this event. I'm very happy to announce that starting Thursday, April 1st, we will also be back in person. So from 4 to 6 every Thursday, we will be hosting open networking in our beautiful large district hall space. And we'll be kicking off a new conversation series with local influencers and subject matter experts called The Future of from 5 to 6. So without further ado, I'll reintroduce you to Danielle, and she will introduce Mark Cole from Ximedica. So take it away, Danielle.
Awesome. Well, I just shared a little bit about our upcoming hackathon tomorrow. So if you just logged in, you can go back in the chat and see the link to that. So make sure you join us for innovating new solutions and technologies to respond to everything that has impacted the state due to COVID. I'm Danielle Sturm. I'm Marketing Communications Manager at the New England Medical Innovation Center. And generally, I think a lot of people know what we do, but if you don't, we support medtech and regulated startups really commercialize their medical devices and digital health therapeutics and applications. And we run a multitude of different programs. So we always ask if you are interested in working with us and getting our support. We are a nonprofit, so the programs are usually free, not always, but please reach out to me. I'll put my link to my LinkedIn in the chat, and we can have a conversation. We can help match you to any of the programs that can support you, really develop your technology, raise fundraising, and get it to market. So thank you very much. And I'm going to hand it over to Mark Cole.
Thanks, Danielle. Good afternoon, everybody. Welcome. Thank you for being here. I always have the unbridled pleasure of introducing Jessica, but before I do, just one word on why we do this, because people ask, well, why do you do things like this? And other forums similar to this within Ximedica? And the answer is quite simple. As a company that specializes in taking ideas and people's concepts and ideas and creativity through to the market and commercializing them, we understand that there's a need to be highly familiar with evolving technologies, gadgets, and innovations. It really helps sort of spur innovative, creative thinking and ideas. And several of the things that you might see today and in the past, they've actually ended up, sort of spurring creativity, spurring innovation, and helping us deliver, final products to the market on behalf of our clients. With speed, with efficiency, and really surpassing expectations. So we love this type of forum. We love getting the combined minds, the mind share of Ximedica in one room and really doing things like this. So we're glad to be able to share it with you. And the person that does all that for us in this particular forum is none other than Jessica Peach. And I'd like to introduce Jessica and ask Jessica to take it away for this month's edition. Thanks, everybody.
Well, welcome, everyone. Happy Thursday. It's spring where I am in Chicago, so I'm starting to feel much more optimistic and cheerful. So I'm going to jump right in. For those who are new to this, we cover a bunch of different categories listed here. They ebb and flow, sometimes more in one category than another, based on what's come out in the public domain. And we also look at this as a highly adaptable list. So you can see COVID-19 represented there, but hopefully in a few months' time we can scratch that one off the list, God willing. All right, so I'm going to jump right in terms of materials. Graphene nano origami by a UK academic team in Sussex. It has explored this kind of concept of straintronics, which is a term I hadn't heard before, the idea of experimenting with ways to physically deform materials to alter their both electronic and mechanical properties. And so they focused on this idea, this kind of technique, to look at computer chips and how to make them faster and smaller. Graphene, which is an amazing material on so many different levels, is a part of what they've been working with to develop a microchip that is 100 times smaller than the conventional microchip today. And so by just creating these kind of origami-like folds in graphene sheets, those sheets start to behave like transistors and become these very tiny microchips. So it's kind of complete game changer for what electronics might look like. We think about something that's in a contact lens today is small, but now we can even get even smaller. It's really very, very exciting what this could actually transgress to. Right, the next material is called a Thermoelectric Ring, coming out of Colorado. This is using the body as a battery by tapping into the differences between natural body heat and ambient air, and then converting that into electricity via inbuilt thermoelectric generators. And of course, this is very interesting because now we can start to have less onboard batteries and use body heat as part of an energy source. So the device has tiny thermoelectric chips planted into a polyamine base that's connected with liquid metal wires, and that can generate 1 volt for every square centimeter of skin covered. So the more coverage you get, the more power you get. And just that 1 volt can generate power enough for a watch or a fitness tracker. And it's also fully recyclable. So the sets that you see here on this finger can actually be joined together in a Lego-like format to increase power output. So a really interesting application that could have an awful lot of impact on wearables in particular. All right, the next material is both a material and a therapy, in that it is a medical sealing patch, also inspired by origami, coming out of MIT. This is intended to seal internal wounds, particularly for post-laparoscopic surgery. It's a thin patch that, as you can see on the image here, folds around a laparoscopic tool. And when it reaches the particular organ or tissue that you're wanting to kind of heal or cover, the patch is pressed into place and unfolds as it does so. It has 3 different layers in it that includes a bioadhesive hydrogel that, when exposed to a wet surface, the gel absorbs the moisture to become quite soft and pliable over those anatomical contours. There's a bottom layer that's coated with silicone oil that prevents it from sticking to the applying surface. And then the top layer of film contains something called Zwitter ionic polymers that have both negative and positive ions. And that's where the healing power of the patch happens, because then it's joined in water molecules to create this kind of barrier that keeps out bacteria and can really help the wound heal faster. And also, as a benefit, the whole thing was biodegradable. So as your injury heals, the patch biodegrades, so you don't have to go back in and remove it. Definitely an alternative for suturing and stapling that is the conventional force today. So Epifix is a kind of a similar type of model, but it is using an allograft to treat particularly foot ulcers for those that are very prevalent amongst the diabetics. But this graft is actually donated quite unusually from human placental tissue. They gathered enough placental tissue from enough consenting mothers coming out of C-section procedures. So the tissue, as you would like to have, is cleaned, and then there's a process that dehydrates it so that the patch itself can be stored for 5 years at room temperature, which is a very meaningful thing in terms of the clinical workflow and process. Apparently up to 15% of diabetics have foot ulcers that are very hard to treat, and if they are left untreated, they can lead to infection and hospitalization or worse, losing that limb. And so what the Epifix does is protect that wound site and promote healing, closing the wound faster than other conventional methods today. This next material makes me smile. It's the idea of an edible hologram in chocolate. They're developed by an academic team from UAE. They've decided that chocolate needs holograms because they want to kind of have a way to mark for tampering, display potentially ingredients, or even distinguish that their very special chocolate is not actually counterfeit. And so how this hologram is made is by starting out with, probably we can do this at home in our kitchens, mixing corn syrup with vanilla and water, and that dries into a film. And then that film is then coated with a synthetic black dye, and that is then etched away, kind of like some children's toys that you see where you kind of got a black slate, and then underneath that black slate is this kind of coloring. And as you scratch away, you reveal what's underneath. And so the hologram impact is formed by diffraction grating. So when light passes or reflects off of that film, you create there's this kind of rainbow color pattern that's visible from different viewing angles. It's quite fun, but I do think there's some interesting applications for this in terms of legitimizing or providing credibility around particular medical devices specifically. But I love the fact that I might get my chocolate in this form in some point in the future. So the next material covers also a couple of other categories, sensors and diagnostics. This is the idea of a thread-based sensor. So back to wearables again, in the context of value. These are threads coated in electrical, conductive, carbon-based ink, and they're able to bend in response to mechanical strain, and that's where the sensor component comes in. So when it's bent, the conductivity of that thread changes. And then when 2 or 3 threads are placed on the back of an individual's neck in an opposite orientation to kind of form an X or a cross, as the subject moves their head and neck, that impedance information can be sent to a computer that then can understand and reflect those head movements in the same orientation in real time. So we start to think about how wearables might have a sense of how you're moving your arms or how you're moving your body, and can potentially have applications for monitoring performance, maybe of an athlete, or of a worker in kind of a repetitive work environment, even monitoring drowsiness for those people who are driving or operating heavy equipment, and also be a diagnostic for a patient disease symptom like Alzheimer's or Parkinson's, where there's shaky body movements that can develop and progress over time. Staying in the realm of sensors and things applied to the skin, this is a hemodynamic skin patch that is able to monitor cardiovascular signals as well as multiple biochemicals in the body at the same time. This is obviously conformable and stretchable. It holds within the design a blood pressure sensor, a chemical sensor that measures lactate, caffeine, and alcohol in sweat, as well as a glucose sensor. So multi-sensor capabilities here. It attaches to an external power source as seen in terms of, on the right-hand side, this series of wires here, and provides reading on a countertop machine or potentially in the future on a smartphone. The blood pressure sensor sends ultrasound waves through the body that bounce off of arteries and create echoes that can be detected, which is, I think, the most novel piece of this design. The chemical sensor also induces sweat to analyze chemicals and fluids. There are other sensors that do very similar, perform a very similar outcome. And the glucose sensor is also able to emit a mild current to stimulate interstitial fluid where glucose readings can be determined. All right, another patch on the skin. This is a cortisol sensing patch. Cortisol is what our bodies respond to in reference to stress. And it can also just naturally be secreted through the day based on our circadian rhythms. Our cortisol levels are high in the morning and then that gradually decrease throughout the day and should be low as possible at nighttime as you start to try and fall asleep. But there are particular diseases, particularly Cushing's syndrome, Addison's disease, as well as for some folks with obesity, that your circadian rhythm and your cortisol production is kind of completely thrown off. And so being able to really understand what's going on and monitor cortisol levels in that kind of a discrepancy, you can start to really truly understand how you may be able to improve one's health for those types of patients. So this uses an electrode made from graphene, that binds to cortisol, and a transistor that measures concentration of the cortisol. And then the tech can also help diagnose and treat psychological diseases that are brought on by stress, if not working for a consultancy like. All right, the next sensor device and diagnostic is an electronic nose developed by MIT in consortium with a whole bunch of other international universities. It's actually been going on for years. What they're trying to do is build a sensor, an electronic nose sensor that's better than a dog's. And so you can see this dog, who's one of the, I suppose, baseline metrics, looking very concerned that technology is going to take over his role in the benefit of mankind. But this sensor system is able to detect different molecules in the air with a sensitivity of 200 times greater than a medically diagnostically trained dog's nose, and also can actually more interestingly interpret what those molecules mean to arrive at an answer for someone who needs to interpret it. So the team have built up this algorithm that's based on just 50 urine samples taken from prostate cancer patients, as well as a control group. An analysis of those VOCs, or volcanic organic compounds, patterns can detect the disease with a high reliability. Of course, I'll take a dog any day over something electronic like this, but it's very interesting to know that this is in development. All right, and also in terms of diagnostics, this 3D skin mapping device coming out of Singapore is a small battery-powered device that's used to create very fast 3D images of skin. The process involves placing a small gold-coated film onto the skin, which transfers the skin oil from the raised surfaces onto the film. Kind of similar to when you are asked to put a fingerprint on an iPad in the police station. So then that film is placed into a liquid solution on the device, and electrical charge is applied with electrodes, and there's essentially a polymer deposit on those sebum areas. And then this creates a high-resolution 3D map of the skin in just a matter of 10 minutes. This academic team believes that this device could help with understanding and particularly diagnosing skin diseases like eczema or I'm blanking on what the other major skin disease is, psoriasis, and to understand kind of the depth of the embedded issues at that skin area. All right, this is a Cutlass device monitor by Atkia. This has gotten CE mark approval in Europe. This is a class 2 medical device that meets the clinical requirements for blood pressure monitoring. It uses optical sensors for heart rate monitoring, and the device performs a kind of a pulse wave analysis to arrive and gain exact blood pressure signals. There's a smartphone that pairs it with an app, and a calibration cuff that you wear for the first time to kind of create a baseline. And Atkia is pursuing next approval in the US market, and it is available in Britain for £159. So it's expect something equivalent probably in the next 6 to 12 months in the US. This AIE handy pen coming out of China, as well as other kind of Chinese-related consortium of academic teams. This is a pen-sized device, as you can see from the prototype they have here, that can detect for harmful gases. It has a series of fluorescing compounds in a tip of a needle, that has silicon dioxide polymer fibers that fluoresce in a particular color in the presence of a specific gas. And so when the pen is not in use, the tip is kind of inside the device. And then as you're kind of testing the environment, a plunger on the pen slides out the tip to expose it. And once it's exposed, that pen is then retracted and it illuminates through a series of chemical reactions, an internal LED light inside the pen if the gas is present in the ambient air. It looks more like a kind of injection system. So if someone starts to pull this out as they stand next to it, it might be quite alarming, but I think the form factor could be improved here, but nevertheless. So this sensor device really falls more in the user interaction category. And this is a concept design. It's nowhere near a reality quite yet. And there's actually a lot that needs to be put in place in order for this to become a reality. But it's an interesting concept because it would allow the user to gain control, back control of their data that is shared, particularly in the public domain. So as you can see on the image on the left-hand side, it's basically a ring with a switch. That when it's off, your face and your location and any data collected in your movements and your choices that you're making in relation to anything working with the internet can be anonymous. The idea here is that this is now, and particularly in Europe, as your data is yours, and you are not ever, without your consent, giving up that data to companies like Facebook and or surveillance cameras. It all needs to be anonymized if it doesn't have your consent. Of course, this concept needs significant software infrastructure to actually become a reality, as well as buy-in from government organizations and private companies that choose to use surveillance of one form or another. The idea is that the paired app would allow the user to customize their contact data setting preferences. So I'm willing to share with Facebook, but not the government, for example. The intent is that the organizing company could act as a liaison and data broker for this kind of invisible world of data trackers that we really have very little visibility to today. What to me is really interesting about this is that there is starting to be a solution that puts control back into the user's hands. All right, robotics. This is an electronic-free, air-powered robot. So it requires no independent energy source coming out of UC San Diego. It's essentially a soft robot that's powered by pneumatic circuits and can move without any form of electronics. So there are these cylindrical chambers that make up the four legs, as you can see on the image here, and they work with oscillating valves that allow for pressurized air in and out in certain sequences. And this enables the legs to bend with 3 degrees of movement in a correct sequence, causing the robot to move across the floor. Or in this case, a rock on a beach. The gait of the robot is inspired by nature's side neck turtles. And there are bubble sensors at the end of a boom, which is this kind of long arm on the side here that extends beyond the body. And so when this robot encounters an obstacle, the bubble of those sensors is depressed and that flips about and then sends that robot in an opposite direction. The fact that they're examining, exploring robots that don't involve electronics is pretty interesting, particularly in the medical space where electronics can get us into some challenges, particularly like, for example, MRI machines that cause them to shut down. Right, this next diagnostic is called the Sensai Robotic Gamma Probe by Light Medical, also a British company. This device enables a physician to laparoscopically look for lymph nodes and lymphatic system metastasis. It can articulate with 6 degrees of freedom, either robotically or manually, controlled at the distal end. And as cancerous tissue is detected, audio feedback is provided via an external console to the surgeon in question or the clinician in question. So the system can essentially provide real-time cancer detection intraoperatively. So instead of going and getting a biopsy and then coming back and then getting the treatment to clear out that tumor, you can all have it all done in one case, which is a lot more efficient, a lot less expensive, and a lot less trauma on the patient. And this device can also ensure that you're leaving no cancerous tissue behind in your sweep after you have done your ablating or whatever methodology you're choosing to take that cancer out. Staying in the realm of cancer, this picture makes my skin crawl, but this is called the Ugly Duckling Skin Cancer Detection System, coming out of the Weiss Institute team at Harvard. This system uses deep learning algorithms to identify skin cancer. So instead of individually looking at each mole on the body, it's using an ugly duckling criteria based on the concept that most moles on an individual look similar to each other. So instead of creating a database of all moles in the universe and trying to determine whether your mole is a weird one or not, it's taking the body's other moles as the frame of reference. So ones that aren't similar to the other moles provide the warning sign. So looking at all the lesions on the image on the patient's back and running calculations on how odd those features are on each lesion, they're able to assign a value to those individual lesions, and that value gives you clarity on which ones are most dangerous. In this case here, the red dots are the ones that maybe need to be excised. Moving into therapy devices, the artificial aorta coming out of the École Polytechnique Fédérale de Lausanne in Switzerland is a attempt to help with heart failure patients. Typically, these patients have to go through an organ transplant, and those organs are few and far between. So this artificial aorta can help pump blood, take pressure off the heart, and potentially reduce or eliminate the need for a transport, at least push the decision further down the line in terms of timing. The device comprises a silicone tube with a set of electronics, electrodes, and is planted right at the beginning of the aorta behind the aortic valve. When the electric voltage is turned on, the tube swells up to hold more blood, and then when the voltage is switched off, the aorta stiffens to pump the blood out. And they've been doing lab models, and they found that this artificial aorta reduces the cardiac energy required by the patient by 5.5%. That doesn't sound like much, but it's a start. And so the team is evolving their work to focus on, of course, product performance, and plan to get it up to at least 50%. So this is a academic program, obviously, and they've got a proof of concept model. This next product is fully evolved, and they are in the process of getting FDA approval, but and hoping to do that soon. This is an Irish company that developed a product called Neuromark, and it's intended for the treatment of chronic rhinitis, essentially allergy symptoms and congestion that involves, instead of some other more invasive procedures, a simple single in-office procedure under local anesthesia. It's an energy-based device that essentially disrupts the hyperactive or parasympathetic nerves in the nasal cavity that are responsible for creating all of that phlegm and runny noses and sneezing and itching and all the rest of it that can affect 25% of the American population. So the long-term therapies that have been around for a while basically involve drugs, and that's less than ideal, but this tech is essentially using the platform of something called the Vidian neurectomy, but without any of the without any biofeedback. It's that particular procedure is limited, but because now you've got a patient under local anesthesia, it's less traumatic for the patient. So there's a super elastic leaflet design that you can see obviously at the distal tip of the wand, and it conforms to anatomy and then delivers safe micro lesions to nerve segments with feedback to the user via a console that can be used to help inform progress of the surgery. This next device is in a Kickstarter campaign to raise money. Those people who invest $159 will get first dibs on this product called the e-knee. It is a pneumatically activated knee brace that has flexible support bars and a gel ring stabilizer around the kneecap, and it's all incorporated into an elastic sleeve that's breathable for comfort. There are 5 airbags, 2 above, 2 below, and 1 around the actual knee in circumference itself, and it's connected to a control box, which is this kind of gadget at the top here that controls the brace. Inside that control box is a control trip, an inertial measurement unit, an electrical pump, and a lithium battery. It's amazing to think of all those things in just that square area. When it's powered up, the device detects movements in the knee, not the need, and responds by selectively pumping air in and out of the different airbags based on the pressure that's needed on the joint. The device is quite lightweight, 11 ounces, and can work continuously for up to 35 hours. And you can remove the box, the control box, and then wash everything else so that it is fully reusable for longer term wear. Right, this next therapy is called Excite OSA by Signify, another UK company, and it's designed to train the tongue muscles to address issues relating to snoring and particularly sleep apnea, those people who have to use CPAP machines at night. So the device has a mouthpiece that has 4 electrodes built into it that are positioned around the tongue. And those electrodes deliver the muscle stimulation. And as the muscles strengthen, that then prevents the tongue closing or kind of slipping back into the mouth during sleep. And for just 20 minutes of daily treatment over a 6-week period, which can obviously be done at home, they've found that they can have a significant impact on snoring levels. And they still need to conduct the clinical trials for sleep apnea, but they believe that they could have a real impact. And then, of course, there's an app that pairs to the device and provides guidance on treatment and monitors trends over time. And they've gotten approval from the FDA. So we talked already about some ultrasonics, and we've also talked about stimulation. This is the 2 things combined. What is really marvelous about ultrasonic stimulation, it involves very little wiring inside the body. And particularly when we talk about the brain, that's a very good thing. So in actual fact, this idea, this philosophy has been around for several years. In 2016, a 25-year-old patient was jump-started out of a coma, deep coma, with this low-intensity focused ultrasound aimed at the thalamus, which is essentially our central processing hub. So this team from UCLA has started to re-engage this therapy, and they've actually been successful very recently on 2 other patients, a 56-year-old man and a 50-year-old woman who had been in comas for 14 months and was able to jumpstart their brains using the same system. So the treatment involves an ultrasound device that's positioned on the side of the head and aimed at the thalamus area. And the treatment is activated for 10 times for 30 seconds each time in a 10-minute period in 2 sessions. And the outcome was these fully comed patients were able to then, after the treatment, be able to recognize objects and even verbally communicate, which is really quite amazing. It's like the idea of jump-starting your car, but now for your brain. It's really pretty amazing. We know very little about the brain in comparison to some, the science that's already been done, and this just further explains or demonstrates that fact. Staying in the context of this of the brain, there is now a wireless rechargeable soft brain neurostimulator coming out of South Korea. This is an implant that uses tiny LEDs to alter the behavior of brain cells that are sensitive to light. So the LED lights can be controlled via a smartphone to deliver programmable patterns to achieve specific outcomes. So the implant itself has an energy harvester. There's a coil antenna that captures alternating magnetic fields and can be harmlessly pulsed through the skin. The idea is it potentially could eliminate the need for replacing an exhausted battery of an implant. And they've been using this to suppress cocaine-induced behaviors, particularly in addiction, in mice that have sadly been injected with cocaine, and have found that they've seen a significant improvement in that mice's desire for to satisfy their addiction over time with the use of this neurostimulator. Right, drug delivery. We can address our love handles without all the effort of doing exercise and dieting, because there's now a fat tissue burning patch specifically for love handles. Thank you, Kevin, for finding this one for us. This comes from Columbia University and UNC. This is a skin patch that's been applied to fat tissue that can turn energy storing white fat, which is the bad stuff, into energy burning brown fat, which is a little bit better, and can overall raise the body's metabolism. So how it works is it can be used commercially to burn off those unwanted pockets of fat, such as love handles, as well as treat, obviously, those more obese disorders relating to diabetes, for example. So this particular patch includes something called rosiglitazone, which is a beta-adrenergic agonist compound drug, essentially one that increases the amount of energy applied, and it's encased in nanoparticles and then loaded onto the patch that contains microneedles. And of course, like some of the other patches that we've talked about in the past, when placed onto the body, the drug gradually releases into the tissues through those microneedles. And they found that when they've applied these patches to the love handles of mice over a 4-week period, those lucky mice got a 20% reduction in their abdominal fat. So more to come here, probably. I hope so. This next category is in the context of disabilities. This is a pregnancy test for visually impaired. One of our research team members, Rachel, flagged this one for us. This comes again out of Britain. The Royal National Institute for the Blind sponsored this work. So this is a pregnancy test that enables blind or partially sighted people to learn the results without having of their test, without having to have another person read them the results. It uses the same basic technology as a P-strip, but it powers a linear actuator that raises a series of bumps, as you can see on that yellow area of the visual, to communicate to the patient. And there's also a contrasting underside here, a series of other bumps that convey that the test was completed correctly, and so that you can have confidence in the results. This is a design prototype, obviously, but they're really essentially looking for ways to take this out to commercialization. I love the name of this company, Hable, kind of combines the idea of handicapped and able in the same word. Coming out of Holland, this is a pocket-sized wireless braille keyboard and controller with a series of 8 buttons that's designed to enable someone who's blind or partially blind to interact with a smartphone. It connects to both iOS and Android platforms via Bluetooth and allows the user to write and edit text, navigate through apps and use shortcuts. And it was developed as a result of a 2017 hackathon by a man, I believe, in India, who helped his blind grandfather every day with their everyday tasks as a child, and was inspired to find a solution for him in the context of digital user experiences. The Hable company is accepting pre-orders, and they expect to deliver to their first customers in April in Europe for €249. Also, in the context of disabilities, the Action Audio is a combined effort between AKQA, which is a design consultancy in Australia, and Monash University, an academic institution there. This idea is taking the idea of a tennis match and making it meaningful for a observer who is blind or has low vision. And what they've done is they've taken the the data, spatial data captured by a computer vision system that uses high-speed cameras to track ball trajectory. You also see this in golf tournaments, I know, because my husband watches quite a few of them. In real time, you can see where the ball is going and provide some electronic line calling. In actual fact, that particular technology has actually been used at the Australian Open this year to eliminate the human judges, replacing them with this technology. So yet another profession that has been done over by technology. So this particular product is converting that data into 3D audio, or something called binaural sound. And that's communicating different audio sounds according to what the ball is doing. So a blip is heard in either the left or the right ear, so assuming that you're listening in a stereo manner, as the ball hits the ground, and of course that left and right is associated with the left and right of the field of play. And then closer to where the ball is to the perimeter of the line, more blips are heard. And as the ball moves in the air, there's kind of a jingling sound. And a high pitch of the trajectory when you've hit with a forehand hit is played, and a low pitch is for backhands. And so there isn't actually an audio clip. It's not going to work in this forum, but in the context that there'll be kind of buffering that you'll miss out on the sounds. But I encourage those who have access or want access to this deck to play it. It's very interesting to even think about how different sounds can actually become meaningful. It's actually a very quick learning curve, which I thought was also interesting, very interesting in terms of the design. The fact that they piloted it in Australia means that it's coming to America soon in all of our potential sports to support those who have vision challenges. All right, the next disability is a vestibular implant. This is addressing a condition called bilateral vestibular hypofunction, and it's a particularly low quality of life disease because it affects the balance and one's ability to walk without falling. The current therapies are really not that great. It's basically you've got rehab and you've got to avoid ototoxic drugs and sedatives for obvious reasons. So this is really a device that can be a big game changer for these particular patients. It's a surgically implanted stimulator that modifies the cochlear implant devices that are available today. And it's designed to activate the vestibular nerve in response to signals from a motion sensor placed on the external surface of the patient's head. In the proof of concept work that they did in a lab environment, 8 patients experienced significant improvements in stability, standing, walking, hearing, and even dizziness. So very promising here. This next disability is a much, much smaller wheelchair that folds down and can be even fold down to as compact a size as fitting in an overhead compartment in an airplane. The basic premise, the core of this design of this device is a wheel that folds. So when we talk about, oh, we don't need to reinvent the wheel, well, these guys decided that they should. The wheel in particular has 6 spokes and a rim that has interlocking sections. And when the locking mechanism is released, the 2 sides of the hub separate. So the spokes and the wheels can fold down, kind of like the ribs of an umbrella. And the company is seeking business partners to try and arrive at a democratic price, meaning they want to get the price down for user testing and certification, hopefully planning for approval in next year. So they think their business model might also include renting chairs as needed for different travel locations, think airport or train locations. They're seeking help, maybe from someone like Ximedica, to help them commercialize this and reduce the costs. Pretty interesting idea. All right, 1 or 2 ideas in the COVID-19 category. Use screen cervical cancer DIY home tests. Celeste, one of our HCID researchers, flagged this one for us, again from the UK. In the era of COVID, of course, people have put off appointments that are more screening based, and that obviously has wide-ranging health implications. Pap smears with our OBGYNs or cervical screening tests are one of those. In actual fact, with COVID, the NHS found that over 600,000 women in the UK put off this annual screening in just 2 months last year. And so that prompted the push to figure out a way to get a home screening option to women living in particularly 5 London boroughs who were overdue for their checkups. And it seemed to work pretty well because they're thinking about rolling it out nationally. So it's a pretty basic tool, obviously a long-handed, a long swab that enables the user following the instructions to collect the sample in the privacy of their home, and then they send it off via mail for testing. And of course, if an infection is found, patients asked to come in for a high priority appointment. We're seeing more and more of this at home, do it yourself with some very clear instructions for the user. This next COVID-related device is a really big game changer. It is a ventilator, and look how small it is. To me, this is completely mind-blowing in terms of when you look at some of the other ventilators out there in the marketplace. It comes from Israel, called the Ventway Sparrow, great name. It weighs just 2.2 pounds. It has a built-in battery, and the ventilator provides both invasive and non-invasive ventilation for patients as young as or as weighing just over 12 pounds. So it really does cover a wide extent of the patient population. The device doesn't require an external oxygen tank and can be operated free from any kind of power source because it has that battery on board, and it can operate without that power source for up to 4.5 hours. There's a turbine used to deliver oxygen that also cools the device, so 2 in 1 there. And there's also a quick start mode that enables a clinician to provide ventilation in 5 seconds with just 3 clicks. So really kind of addressing the urgency of getting a patient on this therapy. And of course, its small size is really ideal for transport scenarios. I'm thinking about land, road ambulances and air ambulances. Ximedica has some experience in this space in particular, but this is just, it's really amazing that it can fit into a very small bag. So then one of the last categories that we have here is called other, and there's usually a few ideas in this category that are just very interesting technologies because they're evolving something that maybe is out there in the non-medical space, but you could see some interesting applications in the medical area. So that's why I include this category. So the Nova H1 audio earrings are actually pretty nice looking pearl earrings that have either a solid body, a solid silver body with a clip and a pearl. And music is transmitted via Bluetooth from a smartphone, just like all the other earpod things that we're used to using now in our ears. But the device channels the audio directly into the ear canal. Because it's lobe mounted, the earrings are providing sound in the ear canal, but that still allows for ambient environment hearing as well. So you're not completely blocked off from the universe. The H1 device also has a microphone that picks up the wearer's voice and channels out wind noise, all just in something that looks like an earring. One charge lasts for 3 hours. It's pretty expensive, but when you compare it to an Apple AirPod, maybe it's not for $315. They've got a Kickstarter campaign with a delivery in September. Right, one of our engineers in Minnesota flagged this one for us. It's actually been around for quite a while, at least 10 years, maybe 20. The Muscle Project comes out of the University of Wisconsin, and it's using clams, real clams, to detect water pollution in real time electronically. So a clam, naturally, when it is exposed to contaminated water, they very wisely clam up because they don't want to have anything to do with that corrupted water. And municipalities along the Mississippi River here in the Midwest have installed these clam-based sensors to monitor the pollution in the river. So a simple electric contact is mounted onto the surface of the clam shell and is able to detect when that shell is closed, and when there is information that's then sent to a central hub that then when 4 clams are all autonomously closing at the same time, operators of the system are alerted and then can start to inspect the water quality. And what I found was wonderful is after 3 months, the clams get to retire. They've done their job after 3 months, thank you very much. And now you can go onto the very happy retirement place that clams go, wherever that is. This next product is a Phoenix robot. It is looking at solving the problem of pruning trees, particularly fruit trees. If fruit trees are pruned on a regular basis, it improves their structural strength and it improves their disease resistance. And so this robot is intending to help support that activity. And how it works is it starts by circling the tree to perform a 3D scan with an onboard LiDAR and camera. And then there's an integrated camera that creates a point cold model of the tree, and then, sorry, that's I think a mold model of the tree, and then performs analysis of which branches should be trimmed to keep the crown of the tree in optimal shape. And then it even has an articulating saw, power saw with an articulating arm that actually performs the actual pruning. Of course, you don't want to be anywhere around the robot as it starts to do that, and the tree limb branches form. But the idea that there is the ability to scan, create a 3D model, and then process that information to decide how to then treat that tree. You could really see that being kind of both diagnosis and treatment in the same thing. You could really see how that could have some interesting applications in the medical space. All right, this one, for those people who are following the space craziness that's happening with SpaceX and all the rest of it, will perk up their ears on this one. This called is the Gnome 4D by DARPA. This is the Gnome 4D stands for Novel Orbital and Moon Manufacturing Materials and Mass Efficient Design. This essentially is an initiative to develop technologies for adaptive large-scale structure manufacturing in space. So instead of having to build them on Earth, figure out how to compress them and put them into a robot, that a spaceship that can then send them up into space and then open them up. Now you can do it all from potentially the surface of a planet, or even a Starship Enterprise device that's moving around in space. And so what DARPA is doing is requesting ideas and proposals for in 3 parts. They are aiming to have this all available and working by 2030 in terms of supporting fast and frequent orbital launches, regular moon flights, and on-orbit refueling, and robots that can build structures and evaluate and monitor operations in space. So the program has three off-Earth phases: achieving efficient targets of a solar array, which I believe is the one on the far right, risk reduction and development of radio frequency reflectors, and the precision building of an infrared structure on a long-wave telescope. So think 3D printing in space, think any number of variables that this could be. But if you're in the inclination of trying to help NASA and DARPA solve this problem, they're accepting proposals. All right, this falls under the category of digital health, because I think we probably all could benefit from it, but it's really another category, and it's the most simple of technologies. Using a Faraday cage in the form of a butter dish-like frame to block all signals to your smartphone when you really want to unplug. And the object is really intending to try and encourage us to live offline. And of course, the Europeans would have figured out a device for this before us. 50 years, commercially available today, and it's called Stop by Juice. All right, there are 3 ideas in the hard category, and I've got 4 minutes left, so let me see if I can walk through it. This one is wonderful for the parents out there that have toddlers who are very picky eaters. This will be fascinating to you. The Het Helpend board, coming out of the Netherlands, is a helping plate. That's what the Helpend board stands for. It creates an optical illusion to encourage kids to eat more vegetables. So you see that kind of dip in the plate is a kind of an optical illusion that actually there's more vegetables there than you think there are. Interestingly enough, when you put food on a white plate, they've chosen white for a very clear reason. It actually makes everything look more appetizing. The scientists or psychologists have found this. And also the fact that because there's a bowl underneath the plate itself, the whole plate is kind of angled more towards you, and your vegetables are presented first and closest to your body. And of course, studies have shown that when the food is placed more in front of the person, they're more likely to eat it. So I wouldn't actually expect this to be available through Atkia in the imminent future, but as a parent who's struggled through toddler years, I am delighted by this one. All right, this one is kind of worrying to me. So it's a different type of heart. The idea that now that's been developed is two-way interactive dream communicating. So if you think you're not doing enough as you sleep, well, Northwestern University is willing to engage you. Actually, this is actually a partnership between a whole bunch of different universities, both in Europe as well as Northwestern. And they're trying to test different techniques to interview patients or people while they're sleeping without waking them up. The lucid dream state is that moment where you're dreaming, but you're actually capable of sometimes steering your experiences. So when you're in that kind of REM mode of sleep, the researchers are actually talking to the sleeper, asking them verbal math questions, and the patient is able to respond with their answers by left and right eye movements that they're trained to do over time. So the correct answers are only gotten 18.4% of the time. I find this hilarious, actually. But when the subject's awoken, they actually partly remember the communications as if they were outside of a dream, or with the questions were being superimposed on it. So they think that this technology actually has some meaningful use for helping develop more musical or athletic skills, deal with emotional trauma, or even try and solve those really difficult medical device moonshot problems while you sleep. So I don't know, I'll save my sleep for another time maybe, but I think this is really quite remarkable development in terms of using our brains. So this last one is our final one at £460 for that. Sorry, $460. This is the Rebounder by Delacon. We've actually featured Delacon before for other devices, particularly in relation to pregnant baby monitoring. But for those people who have standing desks, that's old news. You now need a trampoline, or rather a rebounder, because you need to be getting back more of your activity as if you were a human from 200 years ago. And you're not really, as a standing desk, engaging as many muscular sets. You're not strengthening your bones, you're certainly not increasing your lymphatic system, or even doing backbone cardio to create a euphoric mood-boosting experience while you work. And so Delacon has proposed different configurations of these mini trampolines. They have meeting room trampoline options around a table for people you're co-working with, as well as quick micro workouts throughout your office, or even your home office as shown here. I think this is just marvelous, and I can't wait for someone at Ximedica to get one so we can have a good old laugh as we're watching them bounce up and down. All right, so as mentioned, Ximedica has been doing this forum for years and years, and we have an archive that we mine for different projects, and we welcome folks to come to us with to tap into this if that's something of interest. We do this on a monthly basis, so our next session will be on April 9th. I look forward to seeing you then.
Jess, you're amazing. It's exactly 1 o'clock. That was another fantastic presentation of latest, greatest, coolest technologies. Very impressive.
Yep.
David Horrigan this is his first time at a Venture Cafe, and he's joining us from his yacht in Washington, D.C.
Oh my God.
So I'm glad you enjoyed it, David, and I'm glad you were able to stay for this. We just love co-hosting this session with Ximedica and NEMIC every second Thursday of the month. So for those of you who are new, we hope you enjoyed it, and we hope to see you next month. What is the actual date of that? April 8th.
And the 9th, I believe.
9th, right.
Oh, April 9th. Yeah, sorry, I got my dates wrong.
Yep. Fantastic. Well, thank you. Amy, do you want to bring us home?
I just want to drop the Eventbrite for the next one into the chat, so everybody can register now if they want to. And just remind everybody that we will be on early next week from 9 to 10:30, and then from 11:30 to 1 again. So please follow us on social media and Eventbrite, and we'd love to see you again next week as we discuss all things clean tech and offshore wind energy.
Fantastic. Yes. Thank you, Danielle and Brian, for the first session today. That was fantastic. Workshop, presentation, discussion, super interesting. And If you want to give another plug, Danielle, about what's happening, the hackathon.
Yeah. So everyone that is Rhode Island based, we're running a COVID-19 response innovation hackathon tomorrow, and there is one in April. But if you are free, please join us tomorrow. You'll be able to register. You'll be put with a team that has similar thoughts to kind of what they want to innovate around with all the impact that COVID has had on our state, our healthcare system, our population, our communities. You can pretty much create a new technology or solution to solve that. And then on Sunday, you'll be able to pitch for cash prizes. So we hope that you guys can join us. We have a lot of Ximedica designers, and Ann Bandari is going to be our master of ceremonies and leading this session all weekend. So we're really excited to have those.
Fantastic. Thank you, Mark and Jessica. As always, we love working with you, and this you never disappoint. I don't know how you do it, Jessica, every month, but it's fantastic, and we all love it, and we get such great feedback. And I will also share that for those of you who are new to this, we have a lit District Hall Providence YouTube channel with tons of playlists, including this one. So if you've missed some in the past and want to catch up and check out where those technologies are now, if it was a few months ago, I highly recommend that you visit our District Hall Providence YouTube channel and look for this playlist. And without further ado, I guess we'll cut you loose. And if you can all join us at Venture Cafe Cambridge at 1:30, that's where our team will be supporting our Cambridge family members. So thank you so much, and hope to see you next week or next month.
Bye.